country. The newly nominated National Health Security Secretary now holds a broad sway over many of the biggest federal programs in the U.S. tackling addiction. The Center for Disease Control and Prevention, the National Institute on Drug Abuse, and the Substance Abuse and Mental Health Services Administration. Kennedy, a recovering addict himself, now credits his faith 12-step Alcoholics Anonymous style programs, which also have a spiritual foundation, and the influence of a book by philosopher Carl Jung for helping him beat his own addiction. Joining us now is Dr. Mina Merholm, a medical director for Columbia University's Medical Center. Hey, doctor, how are you?
Hey, Tom, thanks for having me. Good, how are you?
Good, thanks for coming on, doctor. RFK has proposed a sprawling new system of camps or farms where people experiencing addiction would be sent to recover. How and do those camps work?
Well, Tom, the reason that RFK is taking the addiction issue head on is for two reasons. One is because of his personal background, as you mentioned. This is a unique situation where you have someone who battled heroin addiction for 14 years, and a situation where right now we have over 100,000 people that we are losing annually to overdoses from suicide. So there's some innovation that's needed because only 1 in 10 folks who are struggling with addiction are actually getting treatment. So RFK is saying perhaps there is a spiritual reset that needs to happen. Perhaps there is an isolation from a person, place, or thing that is contributing to the trigger of substance use. And that's part of the concept of what he's introducing.
And can you explain to us, doctor, the 12-step and faith-based therapy work and how it works?
Yeah, absolutely. There's been a tremendous amount of research over the past several decades on these 12-step programs for alcohol, narcotics, opiates, and they're based on having a spiritual reconnection, a reset, a time where you can reconnect with yourself, a divine presence as you understand them. And this really makes a huge difference in community as well, because part of what RFK noted, which I think is really key in the way we fundamentally understand addiction, is that addiction is a disease of isolation. And these 12-step programs reconnect us with one another. And they allow us to be able to come to a place where we're not isolated and lonesome, but in addition to that, have ongoing accountability. So that's part of the reason why that data has been so successful.
And what about science-based research and vaccines? Should there be a concern that this will be forgotten with Kennedy at the helm?
Well, this is part of where the scientific community is trying to be cautiously optimistic. RFK is asking questions that are important in order to be able to come to a place where we know that vaccines are safe and effective, and when a good question is raised, it should be taken as such. However, we don't want to undermine public trust in vaccines with what's already been studied, but we do want to be able to take a closer look and say, is there any area we can improve, as science always does? Is there an area where we have to make adjustments? What's been the role of Big Pharma? That's a really important place for us to think about, while at the same time saying we want to continue to be objective and science-based in our approach.
And speaking of pharma, a drug called, I think it's called buprenorphine, maybe the best tool doctors have to fight the fentanyl crisis. Why hasn't this drug been adopted more widely?
Well, Tom, this has been what's tragic. When you're at a place where a drug like buprenorphine is life-saving and only 1 in 10 people are using it, part of the problem is sometimes the way we understand addiction, it's too much framed as a moral issue. Too often it's framed as a failure of someone that's not trying hard enough, being good enough, just doing what they need to. Whereas addiction is oftentimes a disease of the brain, the body, and your surroundings. So part of what can happen, part of the reason that 76% of overdoses can be prevented with medications like buprenorphine is that people are not aware of that fact. People are not aware that Suboxone can save your life and can fight the biological component of these addictions. And this is why we're advocating for in a segment like this.
All right, doctor, thanks for sharing your thoughts on this. And I'm hopeful that, we're going to be successful fighting the addiction crisis in this country.
I'm hopeful too, Tom. And I think with RFK's personal background and spiritual reassessment, there's a lot of hope here.
All right, doctor, thanks again for coming on.
My pleasure.
Appreciate it. Take care. The NTSB chairwoman